This morning, we start with our community spotlight, which is 988 Idaho Crisis and Suicide Hotline. Lee Flinn will be presenting for us. I'll give you a bio for Lee. Lee joined the hotline as director in May of 2020, bringing over 35 years of leadership in Idaho's nonprofit sector. She oversees strategy, fund development, compliance, governmental relations, and statewide partnerships. Her past leadership includes roles as policy director for the Idaho Community Health Center Association, advocacy director for ARP Idaho, founding executive director of Conservation Voters for Idaho, and executive director for the Idaho Women's Network. In these roles, she has been responsible for fundraising, program development, strategy planning, lobbying, advocacy, and board development for 501c3s and 501c4 organizations, as well as political action community. She has served as a volunteer on nonprofit boards as a guardian ad litem for youth and foster care. Lee holds a BA in history and an MBA from Boise State University. Lee, we're super excited to have you this morning, and you can take it from here.
All right. Good morning, everybody. I see some familiar faces. It's good to see you all. Let me share my screen and do the obligatory, can you see my screen? All right. Can you see my screen now?
I think
okay.
so.
I see some nodding. I see Jeremy nodding. Okay.
We're there.
So let me put it into slide mode. Where is that? Sorry, this part always takes me a few fumbling moments. Okay, you can still see my screen? Excellent. Okay, so when I share my slides,
can you swap your screens at the top? Display settings, top left, in the mid, very top, go up. It says display settings at the very top, black in the gray. To the left, there you go.
Dara, what do you see? That would help me more.
I see the screen with your speaker notes.
Okay, with it shows the next slide.
Uh-huh.
All right.
Actually, do you see at the top of your screen? I can see it. It's the second from the left, display settings.
Yeah.
Click there, and then swap.
There, like that?
Yes, ma'am. Now you're good.
Thank you, Dara. All right, so I'll go ahead and dive in. I know we only have a few minutes. I cannot see the chat, so how about if I roll through really quickly and then take questions at the end? And so I'll just dive in. So I'm just going to start with the basics. You may all know this, but just to as a review. So Idaho Crisis and Suicide Hotline is the 988 call center for all of Idaho. 988 is now the universal mental health and suicide prevention crisis number all across the country, and that number 988 went live in July of 2022. The intention was to create a nation-wide number that's easy to remember. Prior to that, the phone number that was across the nation was a 10-digit phone number, and that's kind of hard to remember. So again, it's to help people get the help they need in the moment they need it, to reduce the burden on law enforcement response, and to just make sure everybody knows who to call. There are 988 call centers in every state. Some states have multiple. If you can imagine, states like Texas and New York and California, they have multiple. But in Idaho, it's Idaho Crisis and Suicide Hotline. So basically what we do, we provide 24/7 free and confidential crisis support. About 89% of the folks that reach out to us through call, phone, or text, about 89% our team is able to support, help them de-escalate or reduce stress and keep themselves safe. And for the ones that we're not able to do that, I'll touch on that here in a moment. Those needing in-person care, we now are able to refer them to mobile crisis teams, crisis centers, or depending where a person lives, in some places, in some parts of the state, the nearest hospital might be the best option. Since 2012, when we started, we've now responded to over 174,000 crisis contacts. So we provide support for all Idahoans of all ages. Since the beginning, and I would say especially now in Idaho's fairly new crisis system, we really serve as an entry point into Idaho's behavioral health system. For a lot of people that reach out, they might not be plugged into anything. And so for a lot of Idahoans, we're kind of the first place they may reach out for help. So we provide, again, crisis support for Idahoans in any type of crisis that does include people who are feeling suicidal, as well as people experiencing many other types of crisis. And I'll touch on that in a moment. Person can call for themselves, and they can also you can call on behalf of someone else. We sometimes get parents calling on behalf of their kids, concerned about their kids feeling suicidal. They don't know what to do. We sometimes have therapists calling on behalf of their client, and so forth. A person calling about their neighbor. We also provide follow-up calls to Idahoans that are discharging from some hospitals. And again, our main purpose is to provide crisis support, to help that person support themselves, to help them de-escalate and keep safe. So how to reach us? Kind of obvious, but it is, 988. A person can call 988, text 988, or you can also go on our website. There's a button, and you can do a chat session through our website, which is a lot easier for some people who don't want to type on their phone and feel more comfortable, interacting that way rather than calling. We also have an unpublished phone line specifically for law enforcement and first responders, so they can reach us directly if they need. And one thing that's changed, it's been a while since I've met with you all, but one thing that changed last year that's a really big deal is when 988 first took off, the phone calls were routed by the person's area code. And that was problematic because people move and they don't change their phones. So every single day we were getting out-of-state callers, just like every other call center. So starting last year, all the major phone carriers, T-Mobile, AT&T, Verizon, they are all now routing by the caller's location, not their area code. So that helps a lot because it ensures that almost all the calls we get are from people who are physically located in Idaho. That said, we know there's a lot of fear around, if you call, they're going to know where you're at. When calls are routed to us, all we can tell is that it's a caller within Idaho. We cannot tell. We don't have the level of detail that a 911 dispatcher has. We can't tell where in Idaho someone's calling from. We can just tell that they're in Idaho. I should say on that. So the big three carriers do routing by location. The smaller carriers are not quite there yet. So that is a change that should happen next year. So I've mentioned crisis. We provide crisis support. I just want to touch on some of the reasons that people may reach out. So there is a myth that we're constantly trying to dispel, that a person has to be suicidal to reach out to 988, and that is not true. A person can be in any kind of crisis as defined by them, and really, what a crisis is an experience that prevents the person from really being able to cope and being able to function, day to day. So that can include feelings of suicide, self-harm, mental health concerns. We hear from some people who have homicidal feelings. They want to hurt other people. We hear from people who are grieving the loss of a loved one, kids that are being bullied, current events, breakups, divorces. So really, the reasons that people reach out are very real life experiences that many of us, if not all of us, will go through at some point. This is just a quick glance at our contact volume, calls, texts, chats. And if you can see, the last bar on the right is second quarter 2025. So in the most recent quarter, we responded to almost 7,400 contacts. And if you compare that to second quarter 2024, you can see that's a lot higher. So the last quarter compared to a year ago, our volume is up significantly. I think it's about 25%. One thing I'd like to say at this point is a lot of times people think this is a bad thing that volume is going up. We see it as a good thing because it means people are reaching out. And I think everybody wants people to wants a person to reach out if they need help. So we see that as a good thing. Outcomes. Again, sometimes people out there think, oh, if I call 988, you're gonna call the police, and that is something we also try to dispel. I want to be really clear that in most circumstances, we do not engage or reach out to the police. At this point, it's about law enforcement involvement in crisis calls is about 1% of our calls. And just to be clear, the only situations that we reach out to law enforcement include very serious situations such as a suicide in progress. If we're talking to someone and we find out they've already taken enough pills to overdose or they've taken other steps. In those situations, we stop the crisis intervention and we move to reaching out to law enforcement for a welfare check, actually asking law enforcement to go check on the person. Another situation where we may engage law enforcement is when our crisis responder does the safety assessment and determines that the individual is at imminent risk for harming themselves, killing themselves, or harming or killing someone else. And in those situations, it has to be a situation where the person tells us they are suicidal, they have a plan for killing themselves, they have access to lethal means to kill themselves, and they plan on taking that step in the immediate future. So those things all have to be present, and in that situation, the person is at such high risk that we will also, in those situations, engage law enforcement. And then the same for if someone's feeling homicidal. Most calls aren't like that, but just to be clear, we do not engage the police unless the person is at imminent risk or they've already started to take steps towards suicide. All right, this is where I can touch on how the crisis system's changed. I know we're running close on time. So starting July of this year, mobile crisis teams are now available 24/7, and that's a really big deal. One thing I want to be clear about is as the 988 call center for Idaho Crisis and Suicide Hotline is the sole dispatcher of the mobile crisis teams. And so you can request a mobile crisis team. Anybody can call and request a mobile crisis team by reaching out, calling or texting 988. Although we dispatch, there are two separate companies that operate. And a mobile crisis team, if you're not familiar, it's a 2-person team of behavioral health professionals who actually travel to the person in crisis. So they'll show up at the person's home, the Winco parking lot, the park, the city park, wherever the person's at. There are qualifying crises. We won't dispatch for any reason, but some qualifying crises include, again, suicide, homicide, mental health concerns, substance use, and also medical and neurocognitive conditions. And through the assessment, we determine if the person is low risk or high risk or extreme risk. Extreme risk would include probably a co-response with law enforcement. And then the last thing I'd say is for all of you in this meeting, if you'd like some free materials that have information about 988, please reach out. We've got brochures, we've got some informational wallet cards, we've got some stickers. And if you reach out to me via email, I'm happy to put some of those in the mail, and it might be good to have for some of the upcoming tabling you have or any other event that you all have. And that is it. I'd be happy to answer any questions you might have.
I have a question for you, Lee. What does the profile look like of your crisis responders?
I'm not, what do you mean profile?
So when somebody calls in or makes communication with one of your crisis responders,
Yeah.
what type of person are they getting a hold of on the other end?
Oh, okay. Our crisis responders come from all walks of life. Age-wise, they run from 20-something to 70-something. We have some that are retired, we have some that are students. I'd say really all types of backgrounds. And when someone applies to be a crisis responder and we hire them, we do not have volunteers taking calls. We haven't for, over 2 years now, maybe closer to 3 years. We put them through comprehensive crisis intervention training, and then we have ongoing educational training for them as they go on. So
they're employees, they're not volunteers, and they've
they're
gone through
employees.
quite
We
a bit
do
of
not,
training.
yeah, we do not have volunteers and haven't for a few years now. Yeah,
Wonderful.
that just wasn't a sustainable model for the growth that we were experiencing.
Good to know.
Mhm.
Does anybody else have any questions of Lee, Karen?
Lee, I was curious, are you seeing an uptick in the aging population with calls? I mean, do you kind of keep an idea of age, and any suggestions, since many of us work in the senior industry, of resources if we're dealing with seniors with suicide?
Yeah, I don't think we're seeing an uptick. We do track demographics that we're able to collect. And if you can imagine, when someone reaches out and they're in crisis, we collect what we can, but that's not our emphasis. We focus on, the person, supporting the person in crisis and helping them to keep themselves safe. So we collect what we can on demographics, but we've not seen an uptick in older adults, I would say. But we definitely get people reaching out of all ages. I think as far as the demographics we do collect, our youngest known caller was 6 years old.
Oh, wow.
And that was a boy that called with his dad. His dad called and, kind of facilitated the interaction. And then the oldest caller, to our knowledge, was 101. So we get people of all ages reaching out.
Can I ask a question?
Yeah.
So I do a lot of, I also contract at Lifeways and I've done a lot of mental health nursing even when I was in the hospital. And the change that happened over the last year with Idaho parental consent law.
Yeah.
And there was actually just something that came out on the news today or yesterday about it, that Idaho is very broad in what it considers emergency. So it looks like, and I wanted to get your interpretation, that without parental consent, unless a minor said that they were actively suicidal and had means to a lethal weapon, or they were actively going to take their life, that they would not be able to use the 988 service without parental consent, which is pretty scary because there's a lot of fear, and sometimes things are happening at home that's why they're trying to reach out.
Right. Yeah, I was interviewed a couple times recently, including last week by KTVB. Yeah. So Idaho does have a parental consent for healthcare law that took effect July of last year. So we've been navigating that law. It captured us in it. It wasn't intended by legislators to capture the crisis and suicide hotline. And so yeah, anybody of any age can reach out. And to the extent that all of you can, please let it be known that minors can still reach out to us. What has changed is how we handle that contact. Before the law, no matter who was calling or what their age was, we could take our time and we could, just be with that person for as long as it took to provide crisis support. With minors calling now, we have to, our responder has to do the assessment. And if they are assessed at being high risk and at imminent risk of harming themselves, killing themselves, or harming or killing someone else, we handle the interaction as we would any adult. if they don't and that's an emergency exception in the law. If the caller, if the minor doesn't reach that level of acuity, then we can still support them, but then at a certain point we have to ask if they could, if they have a parent or a guardian that could give consent. So at that point, a lot of minors hang up. They say, oh, I can't do that. And so they'll hang up on us. Sometimes they do. Sometimes they'll say, oh, yeah, my mom is upstairs. I can go up there. And then we can talk to the parent and the kid at the same time. So we're still able 100%. We are still able and are supporting minors. It's complicated how we do that. And honestly, it puts a lot of stress on our crisis responders who are having to think about, now I can't just think about supporting this person. Now I have to think about like, oh, where am I at with the law? So we're in conversation with healthcare advocates and lobbyists who are all trying to change this and are hopeful that in the coming legislative session, the bill that didn't make it through last year will, come out again and pass. There was an attempt by Senator Anthony, who's the pro tem. He brought a bill forward to change the law. It passed the Senate. It did not pass the House. It didn't advance to the House in the last days. But in that bill, it would have exempted us completely. So we're hoping for that approach again.
Yeah, and then I have one more question on this. I saw people saying, oh, I'm going to call into the crisis center and give them blanket permission to talk to my children anytime. Is there a way for you guys to house that information?
Yeah.
Okay.
Yeah, it's not easy, but yeah, we are when a parent calls in or a guardian calls in, if they say they want blanket consent, and we have had an uptick since those news stories hit. So yeah, we do get blanket consent and then we file that. And so, so there are, that's our workaround for now, but it would be much easier if we didn't have to do that. And the last thing I would say on that front is, one of the things we do, I didn't mention, when a person calls, reaches out and they are suicidal, it is best practice in suicide prevention to offer a follow-up call within 24 hours. And we have been doing that for years and years and years and years for everyone. And a lot of people appreciate that. It's like, hey, we're really concerned about you. It sounds like you're able to stay safe now. Would it be okay if we checked in with you about this time tomorrow? And then the person can say yes or no. We cannot offer minors follow-up calls, and that is not best practice in suicide prevention.
Yeah. And then I was just going to add one thing to you guys. I got selected as a delegate for District 21. I'm in the Government Affairs Committee and do a lot of work with District 21, where I live and my business is at. For the legislative tour in Twin Falls in November. And along with a lot of Medicaid stuff that affects our seniors, this is on my list to try to get in front of the legislators, because I'm seeing the impact on the mental health side of things for minors and just access to care. So,
yeah.
Anybody else? Thank you, Danny. Thank you for those great questions. Anybody else have any questions before I let Lee go? Lee, everyone's just said thank you so much and really appreciate it. Mallory had mentioned that they've been seeing an increase in requests for mental health and crisis education in the community. Thank you so much for everything that you do. And this was very informative. We're so appreciative that you took the time this morning to come in and join us.